Data from the White House are giving us more insight about how effective booster doses are in preventing infection from Omicron. Take a look at these graphs we're about to show you. When Omicron became the dominant variant in the country, we saw spikes in new infections, even in people who were up to date on their shots. But the group with the lowest number of Omicron infections were the people who had a booster dose. The data show boosters also protect against severe infection, like what lands people in the hospital. Now, these data are among people who got mRNA vaccines like Pfizer or Moderna. This blue line is the vaccine's effectiveness against the Delta variant. This orange or red line is the effectiveness against Omicron. Now, this observation found that about 6 months following that second dose, those vaccines were really effective at keeping people out of the hospital. But it found that after 6 months, that effectiveness dropped, and the vaccines were even less effective against the Omicron variant. But once a person got a booster, that protection against severe disease went back up and were even more effective at keeping people out of the hospital than before. Doctors in Maine say that's exactly the trend that we are seeing in our hospitals.
Disease. As far as severity goes, again, we see that people who are vaccinated, particularly those who are boosted, even if they have a breakthrough infection, that their illness is less severe. And in fact, their length of stay in the hospital is much shorter than we see with people who are unvaccinated.
What is showing is pretty consistent that the individuals that are showing as being vaccinated that are in our hospitals, the vast majority of them had received their vaccine more than 6 months ago.
So why does vaccine effectiveness dip after 6 months, especially against the Omicron variant? Maine CDC Director Dr. Nirav Shah says there are two big reasons. One, Omicron has a number of mutations that make it appear to our bodies just a little bit different than Delta. And number two, as with any vaccine, even measles or tetanus, our body's immune system response fades a little bit over time.
When you combine Omicron being a bit slipperier, plus our body's own natural fading away of the immune system, you get a reduction in the effectiveness of the vaccine that is significant enough to warrant having a booster. What we've really learned about these vaccines, Chris, is that they work the best when you get all 3 doses. And that's because of the natural changes in our body, as well as the differences with the Omicron variant.